Dr. Makoto, thank you so much for joining us at Abu Dhabi Health Week. I want to ask you, where are we in the process of aging? And what I mean is, how quickly are we going to be able to reverse the process?
Now we know that aging, chronic inflammation can cause the aging. Yes. If we suppress the chronic inflammation, then we can rejuvenate. 10 years to 20 years, something like that. Because, the chronic inflammation likely declines various organ and tissue function. This is aging. So if we can suppress inflammation, then we can rejuvenate. If you target the inflammation itself, definitely we should have some side effects. It's not good for our health. But if we can target inflammation-inducing cells or signals, then we can shut down the inflammation signal.
What is the research surrounding this in terms of getting this to marketing?
Okay, so now there are many concrete evidence that, at least in the mouse system, if we can selectively eliminate inflammation-inducing cells by the genetically or some drugs, definitely mouse shows improved aging phenotype and extend their healthy lifespan. At least we can rejuvenate mice. But we have to think about how we can apply this system to the human. Because in the human, it's a little different from the mice. That type of drugs we may be used for the rejuvenation of the aging.
So different drugs may have different applications.
Yes, exactly.
So what is your advice to people today? Just to take it easy, calm down, don't stress, don't hike that cortisol level.
No, it's very difficult to say because, just depend on the individual, sometimes exercise is very good for the individual healthy lifespan. And sometimes sleeping is very important. Sometimes diet is very important. Just depend on the individual. We have to personalize the system to rejuvenate the people.
How do you get to a point where each individual is targeted? And this is a form of testing, or in your mind, where do we...
Now that we are developing the system, that can determine the aging degree of the individual person. Because, of course, we know the age, but the aging is very different from the actual age. So we have to determine the exact aging degree of the individual person. So now we are developing that system to determine the aging degree.
How far away are we from that?
It's very difficult to say. I hope within 5 or 10 years.
Incredible. Dr. Makoto, thank you so much for joining us.
Thank you.